It is Mental Health Awareness Month, and doctors and nurses on the front lines of this pandemic are dealing with heightened levels of fear and anxiety. Fox's Darius Johnson takes a look at what's being done to help them out.
We're nearly 3 months into a pandemic, and those providing the help now needed for themselves.
The people on the front lines that are seeing a lot of stress, death, anguish, and they have their own fears too.
Dr. Ann Gilbert is the medical director for the Virtual Behavioral Health Hub at IU Health. The Health Hub is a 24/7 call team ready to provide mental assistance.
We offer psychological first aid, which essentially is understanding where that person is, acknowledging their feelings, and then getting them hooked up with whatever they need from there.
You can remain anonymous. After the call, they'll decide if you need further treatment or if you just needed someone to talk to. It's stressful work in an already stressful time.
We know frontline healthcare workers, about 50% of them will develop some significant problem with depression, anxiety, or even PTSD.
What's interesting and what's kind of a little scary during COVID-19 is that there's also the possibility that you might get sick.
There's also a fear workers will pass COVID on to their loved ones. John Shepard, a clinical nurse at Methodist, says there are high demands, especially when caring for patients, but it's what they do and will continue to do until the end, as long as we're in this together.
The common humanity is a really helpful for me to remember that we're all really in this together, and in ways that's kind of beautiful.
Reporting in Indianapolis, I'm Darius Johnson.